Lieber Herr Generaldirektor Strohmeier, lieber Herr Dr. Miescher, sehr geehrter Herr Regierungsrat Engelberger, Shalom Michael Sela, Ciao Jacinto Scoles, cher Jérôme Gallon, dear Don Tomalia, dear Mauro Ferrari, Shalom Dan Per, and I could continue, but you have in your wallet all the experts that are here. Dear speakers, chairpersons, and exhibitors of the European Summit for Clinical Nanomedicine, we are grateful that you all have come. 60% of you are for the first time at CLINAM, and we welcome you cordially to join the CLINAM family in the debate conference. Every year, it is a big challenge to convince people that talking 10 minutes at CLINAM is worthwhile, because you have so much to concentrate on the issue and you have to condense it, and afterwards you have beautiful time, ample time to discuss your science with others and those who are most interested in your topic. CLINAM has become the neutral platform where all stakeholders of nanomedicine and targeted medicine discuss together, coming to fruitful results. And what is nice is that we have, in the 8 years that we do this, created manifold projects and companies, and also collaborations. Yesterday night, I went to one table to ask if everything is okay, and I met two people who just said, yes, we are just making a project together. We would not have done that if we would not be at this summit. So this is really what we are trying to do, to make a spanning, great, to make really a great effort to bring together the community of the world. We are very grateful that Susumu Tonegawa-san has accepted to come to Basel and to have a great talk. As you know, Susumu, you lived 10 years in Basel, and so we can say to you, welcome back. And I would like now to wish you a very good conference. And as next speaker, I would like to ask Dr. Miescher to speak to the community. Thank you very much.
Well, ladies and gentlemen, my name is Guido Miescher, and I represent Swiss government. And in Switzerland, government always comes last. So it's a serendipity that I address you immediately on behalf of State Secretary for Education, Research and Innovation, Dr. Mauro Dell'Ambrogio, and Dr. Gregor Haefliger, Director of National Research and Innovation at SERI. And so it's a pleasure to welcome you all in Basel. Now, Mr. Haefliger has had to attend urgent business in Parliament, and as his direct collaborator, I convey to you his apologies for not addressing you himself. So, we live in a context where it is a big awareness of the European context, and Swiss government is always very considerate of the local state government. So I extend my greetings, of course, to Mr. Strohmeier, and I extend my greetings equally to Dr. Engelberger, from the city canton of Basel, for his commitment to this meeting. Now, the CLINAM Synod we appreciate as a very interactive and creative yearly meeting. On this occasion, I take note of the numerous representatives of regulatory authorities. I take note of their presence as an indication of the imminence of effective clinical applications and of the relevance of cutting-edge research presented at this conference. The participation at CLINAM of at least 19 exhibitors is another encouraging sign. The short talks, long discussions, and the follow-up in-depth discussions in the brokerage sessions make this conference different from more classic scientific conferences. This lively atmosphere encouraged participants to develop ideas and projects. The various companies, consortia, EU initiatives were created in the context of previous CLINAM meetings. This is now the 8th conference driven by the vision to support the development and application of nanomedicine and targeted medicine from the stage of basic research all the way to clinical application. This vision is as challenging as ever, and thanks to the perseverance of the founders, Dr. Löffler and Professor Hunziker, CLINAM summits continue to attract cutting-edge scientists like you, a large spectrum of stakeholders on the path to therapeutic advances. The path involves nanomedicine, targeted medicine, and personalized medicine, and it requires a high level of knowledge in many disciplines, from physics, chemistry, pharmacology, biology, engineering, to nanotechnology as such. The interdisciplinary crosstalk between clinical experimental scientists as well as numerous stakeholders is a central aspect of this meeting. Now, we're talking Swissness, and nurturing dialogue is a Swiss tradition. It is a part of our democratic tradition to establish a shared understanding between stakeholders and to agree on a framework within which constituencies can develop their initiatives and prosper. Scientists used to consider the elaborate consultation procedures in Switzerland, they were a waste of time. We introduced the National Competence Centres for Research, known as NCCR, in the year 2000, and they have earned considerable acclaim for cost effectiveness, productivity, and a surprising number of spin-offs. The NCCRs do involve complex strategy sessions between representatives of university and various federalistic political structures, all very complex in Switzerland. But the time invested in establishing a solid basis for support results in the empowerment of initiators and is not accompanied by bureaucratic impediments. The secret of the NCCR is that they have remained a bottom-up driven process. Likewise, the complexities, opportunities, and risks of nanomedicine require a consensual framework within which scientific advances can be developed into effective therapies. It is a process that requires time and patience. Encouragement of scientific research by the Swiss government is likewise a long-term strategy. We're marathon runners, and we are proud to continue to support CLINAM summits. Our special thanks go to the organizers, Dr. Löffler and Professor Hunziker, who have established this meeting as an important yearly summit for the research community. In the next decades, medicine will experience a transformation to more personalized diagnosis and treatment. Increasingly, individual aspects of the patient and his or her disease will be taken into consideration. High-resolution molecular profiling techniques being developed by nanomedicine research are expected to have an important role in the development of individualized medicine. This conference will highlight many new applications, such as nanodrugs to prevent cerebral malaria, just one example. Last but not least, it is a very special honor to welcome the Nobel laureates, Professor Gerd Binnig and Professor Susumu Tonegawa. More than 25 years ago, at the edge of a swimming pool, I have had long talks with Professor Tonegawa and was profoundly impressed by the immunologist. Now I'm delighted that he has come to Switzerland yet again and will now, as most eminent neuroscientist, give us the opening keynote lecture to this summit. So I wish you all very productive sessions, valuable inputs, and helpful contacts for your future work.